The men and women who worked early on are the real heroes because they signed an oath to protect this nation. They signed an oath of secrecy. They all had Q clearances over top secret clearance. And some of them to this day won't talk about what they did because they were so patriotic and they don't want to mess up the mission.
Welcome to another episode of Spotlight. We have a very interesting topic that I'd like to share with our guest today. Today, I have Laura Welsh from Nuclear Care Partners here to share insight into atomic workers, home care that's provided to them, and the different types of really issues that Laura's been seeing in her field of practice. And this is a little different. It's not something that we're used to seeing. And so when I met Laura, I was really blown away at what she taught me and the clientele that she sees. So I'm so happy to have you here today, Laura.
I'm so grateful to be on your podcast, Athena. Thank you so much.
Absolutely. You know, this was very new to me, hearing care for atomic workers. And I needed you to really explain, what does this mean? And I know our audience is going to have questions too. So before we even dive in, can you tell me a little bit about what is Nuclear Care Partners and give me a little bit of like the background and history of it?
So Nuclear Care Partners was formed in 2009 by two nurses who lead with care and compassion. They used to work for a similar company in another state, and they thought, more people need this benefit, and more people getting this benefit means we're helping people. So they started Nuclear Care Partners, and we provide in-home health care for former atomic workers who worked for the Department of Energy, excuse me, during the Manhattan Project, through the Cold War, and even through today. So what does that look like? In this Bay Area, it's people who used to work at Lawrence Livermore Lab, Sand Lab, GE Valicitos, Lawrence Berkeley Lab, Stanford Linear Accelerator, and there's 300 plus more sites throughout the US that either designed, tested, or detonated nuclear weapons.
Wow. So this isn't just California then, or is it?
It is not. I'm based here in California, and we have several sites that are eligible here in California, but I have colleagues all over the country that do the same thing that I do, trying to find needles in haystacks, atomic workers that can use this benefit.
Yeah. So there's obviously there's a need. You just said a whole bunch of different types of atomic workers that you would be able to support. But I'm going to backtrack just a little bit for the sake of our audience. There's two different types of care that is offered typically to seniors in the big scheme of things. There's home care and home health care. And you mentioned that your home health care. Can you tell us the difference between the two?
We're home health care and home care. We
provide
the entire range of clinical home help that the patient needs for their chronic or acute conditions through the end of their life. So it's not like Medicare where you have to show progress in order to keep the benefit. The benefit follows them until they die. And if they die and there's still money on the table, there's survivors benefits too in monetary form. So this program was enacted by Congress in the year 2000 because people who were working at the Manhattan Project and during the Cold War all of a sudden started getting cancer. And they all had one thing in common. They all worked in an atomic lab somewhere. And not just physicists or chemists or the people that you normally associate, like Dr. Oppenheimer, janitors, cooks, delivery people, motor pool people, anybody who worked on site potentially can reap the benefits of this program.
You know, this is making me think, and this may not be exactly in line what we're talking about, but the movie, what was it, Aaron Brockovich?
Uh-huh.
Who brought this woman, this attorney, right, who brought awareness to, um, was it pollution at the time that was causing cancer?
Yeah,
And
PG&E, I believe, was throwing PCBs in the water system and a whole town
Mhm.
got sick. Very similar, and she knows about this program too. She
Wow,
works with some of the authorized representatives that help connect people with this benefit. So when they get this benefit, when they are approved, they qualify for up to $400,000 tax-free and free medical benefits for the rest of their life for their covered condition, whether it be cancer or Parkinson's or whatever they have. So it's really a life-changing benefit. And we can work in conjunction with other healthcare providers. So if they are taking Medicare home health right now, we can fill in the cracks that are needed. If they're on hospice, we can fill in those cracks because hospice is usually a couple times a week. And we can do up to 24 hours a day of skilled nursing, RN, LVN care.
wow. That's incredible. Well, that is just the best support you could possibly ask for. And you gave us a dollar figure of the type of support or the amount of support that could be allocated to someone if they qualify. How do they apply? How does someone go about applying for these benefits?
So the dollar amount that I threw out there is actually a settlement amount that they get to keep. They don't have to use that money for care. They can go on a vacation,
Oh,
they can buy a new house, they can do whatever they want. Our care to them is free to them. We are paid
wow.
directly by the Department of Labor because these illnesses are classified as workers' compensation illnesses, not workers' compensation injury. So it's illness, so they
Wow.
know it's going to run a long time.
Yeah.
Um, and the Department of Labor will even pay for home modifications if they need it. I've
Wow.
had a gentleman, his split level house had the living area upstairs, and he needed to go downstairs. They installed an elevator for him.
Wow.
Yeah.
That's incredible. Well, and I guess that explains how someone could qualify potentially up to 24-hour care if needed. Um, because it is through this program, right? And that's hard to get. I mean, anybody who's familiar with home care, home health care, it can be very, very costly. And being able to find any kind of program to support your need or to help to compensate for the expense of that's really hard. So this is truly a benefit that we want people to know about. If you've been an atomic worker, there's a lot of other professionals who are supporting seniors that may not be aware of this benefit, or how to go about supporting their client to obtain this benefit, as well as adult children. So could you walk me through, how does someone go about if they believe that their loved one or their client or patient was an atomic worker, maybe suffering from consequences of being an employee of one of these labs that you have mentioned? How do they go out and about to say, hey, I think I have someone that needs this program, and what do I do? What's the next step? How do I even find out about where to go?
The easiest thing is when you're talking to your clients, if you're a home care provider or an assisted living provider or any other of our senior providers, ask them where they used to work. If they
Mhm.
worked in the Bay Area here, Lawrence Livermore Lab, Sandia Lab, Berkeley Lab, give me a call. Let me qualify them. Because the ins and outs of the program can be complex. I don't want to leave anything on the table if something obscure could qualify them. Maybe somebody had an old cancer that's now cured. Well, they would still qualify even though they're not suffering from it. They would at least get the money for it.
Mm,
So
okay.
it's really important. Anybody who has worked at one of the atomic labs, just give me a call, and then I'll do the due diligence. We have to verify the employment. I can help with that. There's a couple claim forms I'll get the medical records and parse through those and pull out the medical records that um, are unique to that person, that uniquely qualify them for their illness. And then we send it all to the Department of Labor. Then we wait a little bit. And once the Department of Labor approves them, then we can start the conversation of having care in the home from nuclear care partners and our nurses.
Now, with the amount of people that you see, is there kind of a ratio with those that are qualified versus those that are not qualified?
There are, luckily in the Bay Area here, the sites have specific dates that will automatically qualify somebody if they have cancer, certain cancers, internal bodily cancers. So let's say, for example, somebody worked at Lawrence Livermore Lab prior to 1989 for at least a year, and they have an internal bodily cancer, except for prostate cancer and except for uterine cancer, they would automatically be approved. And they right away get $150,000 within a couple of months, be eligible for care, be eligible to have their medical bills and their prescriptions paid, their treatment paid for. And then we file another claim to ask how their cancer, let's say, has impacted their body. And they'll do an impairment report and they get another bucket of money.
Hmm.
So it's money, 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 care, care, care.
Yeah, that's great. And you kind of went into that process, right, of qualifying and the timeline. What is the typical timeline from application to approval to receiving benefits? Is there kind of a standard of how long that takes?
For an easy, for a real easy case, it's a cancer related, one of those internal bodily cancers that falls within a nice little set of dates. It can be about 2 or 3 months. If they're terminal, it can be 2 or 3 days.
Wow.
If they're a Parkinson's or a lung patient, a respiratory illness, it'll take a couple of months and there's a couple more hoops to jump through, but that doesn't mean don't do it, because those are the folks that are indeed chronically ill and will need support more and more as they age.
You mentioned internal cancers. That's almost an immediate qualifier. Obviously, there's different forms of cancers. You excluded um, pancreatic uterine cancer. What are some of the other
Pancreatic, prostate.
prostate? Sorry, thank you for correcting me. What are some of the other typical common health challenges that you see coming in, and how are people being affected in their daily lives by these health challenges?
I'm typically, because I've been working at Nuclear Care Partners for 10 years, I have kind of a, a whole host of information in my head. I used to see cancers a lot, internal bodily cancers. Now I'm seeing a lot of Parkinson's. Now I'm
Mm.
seeing a lot of kidney disease, chronic renal disease, which is great for us, not good for the patient. We have developed proprietary programs and innovative solutions for particular disease states, and we're the only provider who has done that. So we have a program that addresses lung patients that is evidence-based, and we track their progress. We work hand in hand with their pulmonologist. We have one for kidney patients, same thing. We track their progress. We can do in-home dialysis now. And we also work with nephrology clinics and nephrologists so that the patient is well supported 360 degrees around them.
Well, I mean, this really does sound like you guys have mastered holistic care for your clients or patients. What would your term be? Is it clients or patients?
Um, we call them heroes.
Heroes.
Yeah,
I
they're
like that.
comic heroes. That's how we refer to them.
That's fantastic. And so how many employees or home health care givers do you have in just the Bay Area alone, actually supporting and taking care of your heroes.
Well, California's a pretty big state, and
Yeah.
I have I actually take care of California and Oregon. So we have probably 50, give or take, and we're always hiring. And we have travel nurses that come in for special cases. We have compact nurses that have maybe not compact, but have a license in California. Maybe they work in another state and they can
Mm,
come in and help if we're stretched thin. But
yeah.
we have
Traveling nurse.
quite a few, quite a
Yeah.
few.
And outside of the United States, are you servicing more of your atomic heroes in other states versus, say the state of California? Is there certain states that are very concentrated?
There's yeah, there's certain states that have sites that were very, very dirty.
Mm,
And dirty meaning they had a lot of toxic stuff. They had a lot of radiation and very little protection in the beginning days. Tennessee, Oak Ridge, the secret city. There's tons of people out there um, that need help. We have events out there, 500 people come and they
wow.
all used to work in some way, shape, or form at Oak Ridge. Yeah, we're in 23 states right now, and I have uh, quite a few up here in the Bay Area, and then I have several down in LA and San Diego as well.
I mean, this is such a phenomenal program, but also it's very disheartening to hear of so many people being impacted because of the work they've done and blindly. It sounds like very much so blindly going into these fields and not really knowing that they weren't being supported or educated, they weren't being protected, and now it's costing them their health or maybe even their life.
Well, I think because it was a novel industry. You know, we
Mhm.
were in a war and we were working hard and fast to get something done. And we didn't know, you know, plutonium was just discovered. We didn't know how that was going to impact a person. You know, we didn't know how much radiation could be absorbed by the human body safely. We didn't know that solvents caused neurological symptoms 25 years later. So luckily, as as the data started coming in, personal protective equipment was put in place. You know, better late than never. Um, but yeah, the men and women who worked early on are the real heroes because they signed an oath to protect this nation. They signed an oath of secrecy. They all had Q clearances over top secret clearance. And some of them to this day won't talk about what they did because they were so patriotic and they don't want to mess up the mission.
That is more eye-opening that both sides were kind of blind going into this and didn't have the awareness of the impact, right? What about families? There's care for the atomic hero. What about those families that are suffering alongside them that maybe it's a spouse or even a child or a caregiver? Is there any kind of support to help them through this process?
It yes, and we have a program that will actually compensate family caregivers if they want to continue to be part of the care team. And the Department of Labor will pay them a certain amount per hour, just like an employee. We hire them as an employee. They have to go through the background check and the fingerprinting and all the stuff that we do when we hire our employees, but then they can be part of the care team. And then there's some folks that don't want to be part of the care team. They want to be the spouse. They want to be the son or the daughter. And we give them the opportunity to rest and have respite and know that their loved one is going to be in safe hands.
So we've got nuclear care partners who's going out there. It sounds like you guys are providing education, obviously being a resource and providing the care. um, What about our other partners out there? We've got home care, we've got other home health care agencies, we've got senior living, we've got rehabs, and not everybody is aware of this. They're not aware of nuclear care partners, of the resources that are available to atomic workers. They're not even aware of such an impact that atomic workers have had or could have on their health. How can we get educated and really become more aware of what's going on out there and how we can be a better partner?
I would love to do lunch and learns and seminars through all of my atomic or all of my community partners everywhere. I'm available all the time. And like I said, we can work in conjunction. You don't have to give up your patients to us. The
Mhm.
only place where we cannot work with an atomic hero is in a skilled nursing environment. But once they're done with the skilled nursing environment, we can take them home and maybe partner with a home care agency that's may want to bill for the DOL or may want to collect private pay, or maybe they have long-term care insurance that can pay for it. Our care is always free, so they don't have to worry about that extra money being spent on their care. But I do lunch and learns every month. I of course am a part of a bunch of networking groups, and I've done a bunch of in services with my community partners. But I'm always looking to do more.
That's great. You did mention how this really is a partnership, right? You're not trying to exclude or remove any kind of care partner from supporting an atomic worker. You're trying to partner with them and support them in the treatment to make sure that your clients are getting the best overall and holistic treatment possible. Um, are there some misconceptions that you're aware of that's out there, whether it's another professional serving a senior or it's a family member about getting this type of care?
Well, I know that there's uh, other professionals that bill the Department of Labor like we do for this population. We're the only
Mhm.
one in the Bay Area that's accredited. So that means that we operate with the highest level of integrity and we have outcomes. We can show you our record. We can show you um, the increase of care, the increase of uh, full functionality of the patients that we serve. So it's really important to know who you're partnering with. And I hope the provider of choice for atomic workers is nuclear care partners, because really we have we're driven by clinical excellence and we have a heart-centered care model. We want to take care of the whole person, and we never want to exclude any community partners because we're a village. We need to take care of our elders together.
Absolutely. So, you said you don't want to exclude partners, and also there's a different level of expertise, right? Um, is there a difference and I know there is, but what is that difference between the traditional home health care and nuclear partners? Is it just the funding? Is it the training, the certification? Is it the equipment that you have access to, or all of the above?
It's a little bit of everything. The funding, of course, is different. Traditional Medicare home health care, you need to show progress. The patient needs to show progress, or else they're discharged. With our population, we know they're not going to get better. The Department of Labor will certify certain number of hours for the covered condition every year. We can do uh, mid-year increases or decreases depending on what the patient needs. So we're really right sizing the amount of care the patient needs um, during the time that we take care of them. And we can, like I said, we can do as little as 1 day a week or 24 hours a day, 7 days a week. It all depends on what that illness is doing to that hero's body at that time.
You part of going through a physical ailment, a condition, or say we have Parkinson's or cancer, whatever that may be. Part of that physical change is also there's a mental change to that. There's an emotional toll that takes on a person. And I know in senior living, that's something that we're always very aware of. It's the emotional mental health of a person. And I know right now we've kind of been talking a lot about that physical health, but I can imagine that if somebody is going through any kind of condition as a result of what they did in the past, the work they've done in the past, there might be some mental health issues or concerns there as well. And I'm wondering, is there any kind of support, mental support, emotional support, and you know, how do we still give our atomic heroes the dignity of independence and feeling that they have a purpose and that they're still united and connected with people without really being put emotionally and mentally in a bad place, especially for those you said, some people don't even want to talk about it. They don't want to talk about the work they've done because they swore an oath, and that oath meant a lot to them. My fear is that people that are afraid to even talk about it, that may be suffering from a condition, that mentally and emotionally they may be going through some really hard times because they dedicated their life to something that in turn ended up really hurting them. And how are they processing that? So I know that was long-winded, but is there any kind of support for people to be able to mentally just feel supported and get past this?
The nice thing about this program is, let's say somebody has a cancer is on their benefit list. Well, we can also put on consequential illnesses into their benefits. So if they are having a mental decline that's related to their covered condition, it can potentially be covered by a psychiatrist or a psychologist to help them through those times. And the nurses that we employ and go out to see these heroes, they become like family to some of these folks. And they are the rocks in their life. They're the steady presence that they enjoy seeing every week, every day, every month, however the visit uh, comes. And so we can help them mentally uh, by recognizing that they're having a downturn, getting a diagnosis, and then getting that added to their benefit so that they can talk to somebody about their struggles.
You gave us a lot of information today. You told us about nuclear care partners, why you exist. We talked about atomic workers and the benefits that are available to them, and how there's compensation, but also home health care opportunities that are available to them, and some of that process that people can go through from start to finish. The timeline, it could be 2 to 3 days to 2 to 3 months, depending on the where that person is at physically and health wise, and the support that you can also offer families and communities. There's so much to learn in this. I feel like we're just really just touching the surface, but I'd love for you to share before we end. What is something that you would love to say to if families, or if somebody's suffering from, being an atomic worker right now and they have a condition, what is a message that you would like to leave with them?
If your mother or father or brother or sister or somebody in your life, if they've worked in an atomic lab through anywhere in the country, or if you're not sure where they worked, they did something nuclear, you're not really sure what it is, give me a call. I can quickly ascertain whether they possibly qualify or not. And it doesn't have to be, like I said, it doesn't have to be somebody who is a chemist or a physicist. It can be the janitor, it could be the motor pool guy, it could be a contract laborer who didn't even get a paycheck from the lab. They got a paycheck from their union. So, but they worked at the lab for at least a year. So anybody that did any sort of work at any of these atomic places, give me a call. I'll see if they qualify and I'll work really hard to get them qualified. If they don't have a discoverable diagnosis now, there's free medical screening available to these workers that they can have every 3 years. And a lot of times they'll find something um, that saves somebody's life that normal doctors don't screen for, heavy metals, things like that.
Laura, thank you so much for being here and just for sharing what you do with our audience. It touches my heart that you guys are making a difference and the people that you're serving, the impact that you're making on our community. And I really appreciate Nuclear Care Partners.
Thank you so much, Athena. It's been a pleasure talking with you.